Hello, my name is Juliet, and the disease or the condition I'm going to be talking about today is asthma. I interviewed somebody who has had asthma that was more prevalent in their childhood, but let me just explain a little bit about what asthma is first. So, asthma causes a chronic or long-term infection in the airways of your body, so like the lungs, the nose, things like that. The inflammation causes reactions like bronchospasms, which is when the airway narrows, which can make it difficult to breathe. Um, Asthma has a good amount of different symptoms, but some of those symptoms include cough, shortness of breath, and wheezing. I think, at least for the person I interviewed, it was the shortness of breath that was the most prevalent symptom of her asthma. And then there are a number of variables that can cause asthma, some of which include like allergies, stress, toxins, or exercise. In order to be diagnosed, you would normally go to an allergist, which is somebody who diagnoses and treats allergies, or you would go to a pulmonologist, which is somebody who specializes in conditions of the respiratory system. And this could go either way depending on, I guess, how the disease came about. Management and treatment of asthma can include things like medications, inhalers, nebulizers, and different therapies. A nebulizer is a machine that takes like a liquid medicine and makes it into a mist so that it's easier for the person to breathe in the medicine when they're having a difficult time breathing. And this illness can cause minor symptoms in some people, but then can also be extremely serious in other cases. So for the interview, so the questions I asked my person, the first one was, what events led up to your diagnosis? She responded with, I realized something was wrong when I was in school. During gym class, I noticed it was more difficult for me to breathe when we did any sort of physical activity, especially compared to other kids. I would also find myself at sporadic times losing my breath when doing just basic activities, so that's when I knew something was wrong. For the second question, I asked, what symptoms did you experience? And she responded with, more than anything, I experienced a shortness of breath and wheezing. I had difficulty sleeping for sure, but I think those were the most prominent symptoms I experienced. For the third question, what testing and treatments have you undergone and how successful were they? She responded, when I was younger, I carried around an inhaler everywhere I went since that was how frequent and sporadic the symptoms would be. At one point, though I don't remember the age, I was using a nebulizer, which is a machine that uses a liquid medicine and makes it into steam so that it is easier to breathe in. That seemed to help quite a bit in lessening the severity of the symptoms for short periods. And then the fourth question, how have the medical professionals in your life treated you during this process? And she said, the medical professionals have treated me well, I would say. I was a child when the illness was most prevalent, and my mother would handle all of the medical visits and things like that, so I have little recollection of how I was treated and how the visits typically went. For the fifth question, what is the prognosis for your recovery from this condition? She said, I have not needed to use an inhaler or nebulizer for many years now, so I would assume I have recovered from this condition, though I have not had it tested. I have been able to work out without issue and do most things without an uncommon loss of breath, so at the very least, I would say the treatments I had when I was younger helped. And the last question I asked, what would you want future healthcare professionals to know about someone who is suffering from this disease? And she said, I would want healthcare professionals to know that having compassion is so important in understanding what people with asthma go through. Not being able to do basic everyday tasks and activities can be extremely difficult regardless of the age. So also doing everything possible to increase ability to do those things is imperative. She was very kind to interview, and I think I could really understand a little bit more of what she went through as a child in having to deal with asthma, but also to see how much technology and medical advancements have helped, because, she can do a lot of things and doesn't have to deal with the symptoms of asthma anymore. So even if her case was a little less severe, I think the interview was very informative, and doing the research was very informative. Also, all of the information I gave in the beginning about asthma comes from the Cleveland Clinic, which I will leave the citation for. Thank you so much.